Hello and welcome to 3-minute revision on major postpartum hemorrhage management. So major postpartum hemorrhage is an obstetric emergency. First thing we need to do is call for help. Then it's important for resuscitation, monitoring and investigation of the lady, and also to stop the bleeding. Stopping the bleeding can be divided into non-pharmacological, pharmacological, and surgical. Firstly, call for help. We need to call the midwives, obstetricians, anesthetics, blood transfusion lab, and the porters. Resuscitation is, as per usual, airway, breathing, and circulation. For circulation, we put in 2 large bore IV cannulas. We can give IV fluids to replace the blood loss. We can give blood and also blood products. For monitoring and investigations, we do bloods on the lady, full blood count for anemia. We group and cross-match 4 units for blood transfusion. We do baseline U&E and liver function tests and a coagulation screen. We need to monitor this lady closely using an early warning score, including blood pressure, heart rate, oxygen saturations, respiratory rate. We need to monitor for blood loss. Stopping the bleeding can be divided into non-pharmacological, pharmacological, and surgical. From a non-pharmacological point of view, we can massage the uterus, rubbing up a contraction. We can bimanually compress the uterus. We can also empty the bladder by inserting a urinary catheter. For the medical or pharmacological management, we can use the mnemonic O emergency, tell the consultants and midwives. O is oxytocin, and that causes the uterus to contract. E is ergometrine, and just to be aware that this is contraindicated in ladies who are hypertensive. T is tranexamic acid, and that's an antifibrinolytic drug, so it stops the breakdown of clots. C stands for carbaprost, and that's a prostaglandin analog, and that causes the uterus to contract. And finally, M is for misoprostol, and again, that's a prostaglandin analog that causes the uterus to contract. Finally, the surgical management of major postpartum hemorrhage includes if we have any tears in the perineum, the vagina, or the cervix, we can suture them. If there's any retained placenta, we can manually remove that in theatre. We can insert a balloon tamponade to compress the bleeding vessels. The next surgical method is a B-lench or a brace compression suture of the uterus. We can also ligate or embolize the arteries that are supplying the uterus. We can either do that to the uterine artery or the internal iliac artery. And finally, a hysterectomy. So that's the emergency management of primary major postpartum hemorrhage.